Okay, so welcome to Eat, Move, Think, the show about optimal wellness brought to you by Medcan.
Wow. Do it again.
Oh, I was practicing.
Okay, ready?
Welcome to Eat, Move, Think,
the show about
optimal wellness
brought to you by
Medcan.
Yeah, this is extremely good. Thank you.
Chris, do you take a vitamin every day?
When I remember, I do take, it's not actually a vitamin, it's a mix that you put into drinks that I'm not going to mention the brand of.
Oh, it's not a Flintstones or like a gummy or anything like that? Because I take the gummies.
Flintstone vitamins were the best, actually.
I wonder what the vitamin content of a Flintstone vitamin is. It's interesting.
I wonder what the sugar content of a Flintstone vitamin was.
Oh, that's a bigger question.
And then how much did the sugar content balance out the benefit?
What were they supposed to be flavored as?
But we're not talking about Flintstone vitamins. We're talking about multivitamins in this episode and their effect on your brain.
Totally. And I think in the past, there's been a lot of debate as to whether multivitamins can actually benefit us or not. And there are some recent studies that say that, yeah, for a certain population of people, multivitamins are very beneficial, especially for our brains.
Oh, that's interesting. So do you have any stats for us?
I do. So in the more recent of those two studies, which we'll be delving into in this episode, the researchers estimated that 3 years of multivitamin supplementation roughly translated to a 60% slowing of cognitive decline in that population. And that equals out to about 1.8 years less of cognitive decline.
So a small thing like taking a daily multivitamin could potentially give you nearly 2 years of optimal brain health.
Yabba dabba doo. I'm Jasmine Ratch.
I'm Chris Shulgin.
We're the producers of Eat, Move, Think. And in this episode, our Eat host, Leslie Beck, who's also the clinical director of food and nutrition at Medcan, is in conversation with Dr. Sharon Cohen.
She's a behavioral neurologist and the medical director of the Toronto Memory Program.
Together, they provide their expertise on nutrition and on brain health. And it's incredible, the two of them together. You know, they really break down how you can get the most benefit out of your multivitamin and how you can also use your diet to get those vitamins as well.
It's also a wide-ranging conversation on the relationship between the stuff you eat and your gray matter and your brain overall. So They talk about that. It's interesting. This is a really fascinating episode.
Food for thought.
Well, let's get to that food for thought. Here's Leslie Beck in conversation with Dr. Sharon Cohen.
Welcome back to Eat, Move, Think, Dr. Cohen. How are you today?
I'm fine. Thanks for having me. It's nice to be back.
Oh, that's great. It's been a while since you've been on our podcast. So tell our listeners a little bit about the Toronto Memory Program and your role there.
Okay, well, lots been going on in the background, even though we haven't spoken in a while. And I'm a behavioral neurologist. I'm heavily involved in trying to move the field of Alzheimer's forward so that we have better treatments and better care. And we are at a turning point now in Alzheimer's disease where we have new diagnostics that can be applied early in the disease and are accurate to give a biologic diagnosis. And we have new treatments coming that will slow the disease. So I'm the medical director, principal investigator. I've had this role at Toronto Memory Program for about 30 years. We have a large staff of, last count, 50 individuals. I never thought we'd be this big. And we are all really devoted to our patients in the memory clinic and in our clinical trial program to move promising treatments forward.
Oh, that's fantastic. Yeah, I think it is a really exciting time to see all the research that's been happening over the past 5 or 10 years, showing the role that nutrition and diet play in healthy brain aging. You know, whether that means slowing age-related cognitive decline or helping to protect against Alzheimer's dementia. You know, I read these studies regularly now, from flavonoids to vitamins and minerals to anti-inflammatory diets. We really are learning a lot. So, Dr. Cohen, what's exciting you about the fight against Alzheimer's dementia?
We've been making huge strides. And after years and years of interventions failing and having to go back to the drawing board and saying, why did this drug not work? We thought it was going to be helpful. Why did that one not work? Some themes have come through. And these themes are, you have to go early in this disease. You can't wait until the brain's substantially damaged. So targeting healthy individuals or people who have mild memory problems but have not lost millions of brain cells yet. That's important. And targeting underlying key pathologies of a disease like Alzheimer's, not just trying to put Band-Aids on symptoms, but actually get at the root pathologies and target those. That is now happening through a variety of experimental drug programs and some coming to the market finally. So that's very exciting, and a recognition that lifestyle plays an important role protecting people against brain disease and building cognitive reserve, and that it takes a combination of brain healthy lifestyle, of which diet is part of that, or dietary pattern, but also for those who actually have the beginnings or later stages of Alzheimer's, it's going to take more than lifestyle strategies. Just the way you can't treat cancer with good diet alone, you might be able to protect people from cancer or delay onset of cancer. But once people have the disease, you need a combination of healthy living plus more substantial pharmacologic intervention. So I think the field's coming together. It's not an either or. It's not a, sort of conflict between two streams. Some experts are saying, I'm not so sure there is such a thing as age-related cognitive decline. This is the beginning of a neurodegenerative disease. So, and you have people who, are healthy 100-year-olds who have no cognitive decline at all. So it's very interesting. We'll see what time teaches us.
So let's move to nutrition now. Let's dive into two recent studies that came from the large-scale Cosmos trial that were prominent in the media. And for our listeners, Cosmos stands for Cocoa Supplement and Multivitamin Outcome Study. And this was conducted in a little over 21,000 men and women. And it was to investigate the effect of daily cocoa supplements or multivitamins on the risk of heart disease, stroke, cancer, and other health outcomes. So today we're talking about two studies that looked at the effect of a multivitamin and mineral supplement and cocoa flavonoids on age-related cognitive decline. And let's start with a definition. Dr. Cohen, what do we mean by age-related cognitive decline? What happens to our brains as we age?
That is such a good question, because our concept of age-related cognitive decline is actually shifting. We used to say it's normal to lose a bit of memory as you get older. That's without there being any neurologic disease. You just lose some brain cells. That's a natural process. And memory's not as sharp. Reaction time is not as good. More word finding moments where you know what you want to say, but you can't pull up that word. And we can all identify with those kinds of symptoms. But when we look at people now more carefully and define cohorts biologically, the people who are having the most trouble with that, even though they look like, just normal seniors, they actually have amyloid plaque or the beginning of Alzheimer's. So is there really such a thing as age-related cognitive decline, or is it just that we were sort of misdiagnosing the earliest stages of Alzheimer's? So I think there's a debate there. Nonetheless, at the moment, we would concede that on timed tasks, as we get older, we're not as quick. So maybe Jeopardy is not our game, but the fund of knowledge is there, and we continue to learn and expand our fund of knowledge and our vocabulary throughout the lifespan. But a bit more word finding, can't pull out the word at the moment you need it, but we keep growing our vocabulary. And our wisdom, which is a big part of executive function, our reflection on how things are going, integrating information and making decisions, that actually improves over the lifespan. So it's very tricky. Some things seem to get better, but definitely attention, reaction time, multitasking is not as strong as we get older, even if we try and separate out the memory problem that begins with a disease like Alzheimer's.
I see.
I hope that's not too confusing.
No. But you did mention executive function. Tell our listeners what that means.
Yes. So executive function is one aspect of cognition. So cognition refers to thinking, and we break it down into different aspects of thinking: language ability, memory, being able to concentrate and pay attention, being able to navigate in space, that's visual perception or visual spatial ability. And then there's this executive function task, which many people sort of think of the frontal lobes of the brain as presiding over. Executive function is the ability to have insight, to reflect, to make decisions, to organize, to plan. So yes, you need to remember things that you want to organize, but it's separate from memory. It's the ability to actually structure things to meet one's goals It's a very important task. If you're not goal-directed, you can have all the language ability and navigation ability and memory in the world, but you won't get anything done. So that's what we mean by executive function. So it's a whole host of important abilities.
Thank you. So let's start by talking about the Cosmos Mind study that was published last year. This was a 3-year randomized controlled trial that involved 2,200 older adults, and it concluded that taking a daily multivitamin and mineral supplement compared to a placebo pill improved global cognition, memory, and executive function, especially in people with a history of cardiovascular disease. And there was no beneficial effect found from the cocoa flavonoid supplements. So I'm going to ask you what your take is on those findings. But first, another definition. What do we mean by global cognitive function?
So scales that look at global cognition are looking at more than just one cognitive domain. So they're looking at memory plus executive function plus reaction time, could be visual perception. So we're looking across cognition and not dissecting out any one domain.
Okay. So you've been studying cognition for virtually your entire career. What is your take on the Cosmos Mind study findings?
Yeah, it's so interesting. This is a large study, and the two sub-studies, Cosmos Mind and Web, thousands of individuals here in the community, and a novel design allowing telephone interviews or web-based interviews, depending which of the two studies. So, sort of a pragmatic approach to assessing seniors annually. And not only do they enroll a large number of individuals and randomize them to a placebo-controlled design of either taking an active vitamin supplement or placebo daily, but they followed for 3 years with annual measurements with a fairly good completer rate. So I think that's definitely a strength of the study, and it's of high interest. People value their cognition, their ability to stay autonomous and independent as they age. We don't want to be losing our cognitive abilities. Even if our heart and our lungs are working, there's not much fun in thinking you're going to end up having to be looked after in a nursing home because your brain doesn't work. So high interest, large study, very good period of follow-up and good retention and pragmatic design. I think the things that one has to ask is, what was the effect size? So the primary outcome measure was met. There was improvement in the multivitamin group over the placebo group in what's referred to as immediate memory. And really the measure of immediate memory was more what we would think of in cognitive neurology as attention or concentration, not so much remembering events. And the effect size was small. But okay, we're taking presumably cognitively normal people. And if you can boost attention or memory a little bit, and you do that year after year for a duration of 3 years, that may be protective for the brain. So I think it resonates with us that something as simple as a multivitamin can be beneficial. Of course, the literature is replete with a lot of contradictory results. And so it has to be looked at, the study, in the context of other studies that haven't shown the same benefit.
How big of a cognition benefit did a multivitamin and mineral supplement provide?
In the Cosmos Mind study, what we saw is global cognition, the measure of global cognition, was improved over placebo at 1 year and 3 years. The effect size was small, but there was an improvement. In the Cosmos Web study, we saw that immediate memory was improved at 1 year and sustained improvement at 3 years, although the other outcomes were not met.
So let's quickly discuss the second study, the Cosmos Web trial, which was just published in May of this year. And this trial involved 3,500 Cosmos participants, average age 71. And it looked to see if taking a daily multivitamin and mineral supplement for 3 years would improve memory. The participants performed, as you mentioned earlier, a series of web-based cognitive tests, but these were designed to detect short-term memory loss due to normal aging. And they did these tests at the start of the study and again at the end of the study. And again, compared to people in the placebo group, those taking the multivitamin and mineral supplements had improvement in something called immediate memory recall, which I've read is a cognitive function that's particularly vulnerable to aging. And in fact, the researchers estimated that the multivitamin and mineral group improved memory performance equivalent to 3.1 years of age-related memory change. Dr. Cohen, what do you make of these conclusions?
Yeah, it sounds very impressive if you could have a difference of 3 years plus.
Yeah.
When you take this multivitamin, it's a very simple intervention, very safe intervention, and it sounds like you're getting benefit that's sustained. What I think one has to ask is, with normal age-related memory change, the decline is very minimal. If you don't have a brain disease causing more accelerated memory decline, a disease like Alzheimer's, then you're losing very little cognition over the years, even if you're over age 65. And so the effect size, even though there may be a little bit of benefit with a multivitamin daily, is it enough that you're going to notice it in day-to-day life in a functional or meaningful way? But obviously they were able to measure it on the immediate memory task. So that's something, and that hasn't been shown before in this kind of a study with a web-based tool. So I think it's very intriguing. One wonders why other cognitive outcomes weren't met, but I agree that immediate memory is an important one in age-related cognitive decline. It speaks more to attention and focus than actually remembering events.
Yeah, you make an interesting point. Just because something is statistically significant doesn't mean that the effect is large.
Right.
So, Dr. Cohen, can you speak to the relationship between vitamins and minerals and brain aging? I mean, these two studies do certainly suggest that just as a developing brain requires certain nutrients, so does an aging brain. Are there certain nutrients that we should be paying special attention to for healthy brain aging?
Right. So when it comes to vitamins, there are 13 vitamins. They are essential for physiologic function for the body, but also for the brain, all of them. And, it's so interesting that we have evolved such that we don't make these vitamins. Our body doesn't make them. We are reliant on obtaining them from our diet. So hence, front and center, dietary pattern is important because you need these vitamins. Otherwise, you will succumb to diseases, and not just neurologic diseases, other diseases. So how we get them and how much we need is of high interest. Of the 13 vitamins, a lot of attention has been paid on a small subset of these as far as brain health, but they are, as I said, all important, and only certain ones have garnered attention, and probably that's really not adequate for our understanding. And for example, most people think of vitamin A as important for your vision. You need carrots in your eyes. Your night vision is good.
That's right.
Vitamin A is actually essential for neurogenesis, the development of the brain. But in the developed brain, it's important for brain plasticity, for how cells talk to each other and networks interact. So, vitamin A is important for the brain. The B vitamins, there are 8 B vitamins. They are all important. They're crucial, and they interact. And again, attention's been paid to maybe 3. And these B vitamins are important for energy for the brain. They're important for synthesis of chemicals and other essential, DNA and RNA synthesis. That's kind of important. The genetic blueprints in cells. And numerous neurochemicals, and you cannot have normal brain function without them. So we know, with certain diseases that get more attention, people may have heard of Wernicke-Korsakoff's disease. When you're deficient in B1, that's thiamine, or the dementia associated with B12 deficiency, that gets a fair bit of attention. And we know what levels are critical to prevent overt brain disease. But what we don't know is what's the optimal level just for regular brain health. And rather than taking a select few of these B vitamins, we probably should be taking, a broader range of B vitamins at a reasonably good dose. There really isn't any toxicity associated with the B vitamins, so people shouldn't be afraid of them. And And lots of people are deficient in B vitamins. That's the other part of the equation. And then there are other vitamins that we don't really think of as associated so much with the brain. For example, vitamin D, we think of bone health, or vitamin K, we think of clotting in the blood. But these vitamins are really important for immune modulation and immunoprotection in the brain. And the list goes on. So you can see that vitamins have much more varied activity and brain-specific activity that we haven't paid attention to before.
Yeah, it's something that I don't think people think about. That's right. What do we know about what happens when the brain doesn't get enough vitamins? How could that affect someone's cognition, both in the short term and the long term?
So some of the syndromes, the neurologic syndromes due to vitamin deficiency, are better studied than others, and particularly with the B vitamins. So I mentioned something called Korsakoff syndrome. When you don't get enough thiamine, then your memory starts failing very severely, and you also develop a gait disturbance and uncoordinated gait, and eye movements are disordered. So it's a very characteristic syndrome, and the parts of the brain that are affected are the cerebellum and the thalamus. But without getting too technical, it's a very specific brain syndrome. In a disorder where one's B12 deficient, the spinal cord degenerates, the brain is also impacted, and people develop a dementia that can look like Alzheimer's disease. It can be an Alzheimer's lookalike. They can also develop numbness and tingling in their arms and legs, so peripheral neuropathy, and atrophy of the optic nerve, so visual disturbance. So you can see, these vitamins and the examples I've given have so many effects. And here I'm just talking about the nervous system, not even the rest of the body.
Right. So, Dr. Cohen, do you typically recommend adults take a daily multivitamin and mineral supplement to protect their brain health?
That's such a good question. I think that what neurologists tend to do is look for deficiencies. So we would measure if as a cognitive neurologist, if somebody's complaining of memory problems, I would check their vitamin B12 level. If it's normal, the tendency is not to say you need more B12 because it'll just be peed out in the urine. However, being mindful of our conversation we've just had, it is probably prudent to acknowledge that we don't know the optimal level of intake, and all of these vitamins are important, and particularly in seniors who may have digestive problems or may not be eating regularly or a balanced diet. I do see the value in taking a regular multivitamin, and you'd be more expert than me. And of all the varieties on the shelf in the pharmacy, what do you choose?
Yeah, yeah, there are a lot, that's for sure. But I agree. I mean, I typically do recommend a daily multivitamin and mineral for our clients here. And you mentioned B12. You talked about that a little bit, and it is a recommendation that adults over the age of 50 get the majority of their daily B12 from a supplement like a multivitamin or fortified foods, because up to 30% of older adults become less efficient at absorbing it from animal foods because they're not producing as much stomach acid anymore. It can be difficult for some people to meet daily requirements for certain nutrients from foods alone, especially for people who have a very narrow diet. They don't eat a big variety of foods, or people, that have a low appetite and eat a lower calorie diet. So it gives you a little bit of insurance. But your point is well taken that we don't know the optimal amount. So, but I think, as you say, certainly a daily multivitamin mineral supplement is considered safe. It's inexpensive.
It's interesting with vitamin D in clinical practice. We see low vitamin D levels so often in our climate here and our pale skin condition, people not getting enough outdoor sunshine, that a lot of physicians have stopped even measuring it because they assume it's going to be low. And I think that's, we shouldn't be sticking our heads in the sand. If we realize not only is vitamin D important for calcium metabolism and bone, but calcium metabolism is so important for the brain, and immunoprotection is necessary in the brain, maybe we need to rethink this, and vitamin D should probably be a regular supplement for not just seniors, but for anybody who doesn't really get out in the open air or has long winters the way we do.
Exactly. Yeah. And at Medcan, as part of our annual health assessment, we routinely measure vitamin D in the bloodstream, also B12. So we're looking at those things to see if people have insufficient levels, whether they're deficient or whether they are sufficient, and basing recommendations around that. But yes, I agree. I mean, Osteoporosis Canada recommends that from a bone health perspective, that adults take vitamin D year round. So, Dr. Cohen, before we say goodbye, could you leave our listeners with 2 or 3 of the most important things that they should remember around this whole topic of nutrition and brain health?
So number 1, I would say the brain is precious. Look after it. The brain needs vitamins. We can't make them ourselves. You need them from your diet. So have a healthy, thoughtful diet. And where you may not be getting adequate vitamins and other nutrients from your diet, there's no shame in supplementation. And if you don't have a specific vitamin deficiency that needs a particular regimen of intervention, a daily multivitamin is probably very sensible, because these vitamins do things not just for the body in general, but for the brain. And we want to keep the brain beautiful.
Thank you for that. I think it's also important to emphasize that by no means are we saying that a multivitamin and mineral supplement is the only consideration when it comes to nutrition for healthy brain aging. Following an anti-inflammatory eating pattern like the Mediterranean diet or the MIND diet is very important too. And both of these diets are rich in plant foods, whether fruits, vegetables, whole grains, nuts, which supply many vitamins and minerals, but also phytochemicals that are crucial for brain functioning. You know, they exert anti-inflammatory, antioxidant properties that are thought to protect brain cells. But that's a whole other podcast, so I won't go there. Thank you so much, Dr. Cohen, for sharing your expertise with us today. It's been wonderful having you on the podcast.
My pleasure, Leslie. Thank you for having me.
Oh, you're welcome. Stay well, everyone.
That was Leslie Beck, Medcan's Clinical Director of Food and Nutrition, in conversation with Dr. Sharon Cohen, Behavioral Neurologist and Medical Director of the Toronto Memory Program.
To book an appointment with a Medcan registered dietitian, email nutrition@medcan.com.
Follow Medcan on Twitter and Instagram, and subscribe to us on YouTube at Medcan Live Well.
We'll post episode highlights and other links you can visit on our website at eatmovethinkpodcast.com.
Say hello and send us a tip or a suggestion by emailing us at info@eatmovethinkpodcast.com.
Eat Move Think is produced by Ghost Bureau. Jasmine Ratch is managing producer. Social media and strategy support is from Chantal Gertin, Andrew Imex, and Emily Bozick. And executive producer is me, Christopher Shulgin.
And we'll be back soon with another episode examining the latest in health and wellness. This podcast episode is intended to provide general information about health and wellness only, and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations, and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with any specific information highlighted. Any third-party links are not endorsed by Medcan.